There you go. You want to hold this?
Перевернуть, наверное?
So,
Подожди, как ее переворачивать?
so here's the opening screen. This is intense pulse light. This means that the chiller is going. So it's saying that this has a cooling plate. Do people want to feel that? This is so that you don't burn the skin.
Все прохладно.
So this is why we can actually get really close to the lid margin, because we're not going to burn that thin skin around the lid margin. All right, so then the chiller is on. Where you guys are going to be doing treatments is anywhere from 10 joules, and the most that you're going to give somebody. Let's see if my parameters are here. Okay, my parameters are not. So we've got to add my parameters in. So let's go here. New. Toyos IPL. Check. Let's cancel that. All right, so here's one pulse, two pulses, three. So this is going to be a triple pulse. So with our parameters, what we want to do is go triple pulse. So instead of giving all the energy to that thin skin of the lid margin all at once, what we want to do is pulse it. So it's on, off, on, off, on. And what we're going to do is we're going to give it 6 milliseconds of on pulse. And then what we're going to do is go to 50 milliseconds of thermal relaxation time. So what it's saying is we're giving 6 milliseconds of 14 joules. Then we're going 50 milliseconds of thermal relaxation time before we give them another 6 milliseconds of 14 joules onward.
Ну да, получается 6 миллисекунд. 6 миллисекунд это импульс, и можем слушать 14, потом паузу 50 миллисекунд, чтобы охладиться, и, соответственно, дальше. Можно разные выбирать на один импульс, на двойной импульс и на тройной. Все как бы индивидуально подбирается, по времени можно регулировать.
So the advantages is you have the chilling plate, you can go multi-pulse, and then you can control the parameters in terms of milliseconds of pulse versus milliseconds of thermal relaxation time.
Мы можем контролировать все параметры. Для того, чтобы охладить, можно тройной импульс использовать.
Then the other thing is you can control the filter. So right now this has a 755 nanometer filter. We don't want that. Remember we said we wanted the reds. We want 600 to 700. So what we're going to do is we're going to change the filter
Можно менять еще фильтры.
to a 590 filter. So what the 590 filter means is that anything lower, any energy level lower than 590 will be blocked by this filter, and it'll allow anything above 590 to come through. And that's what we want. We want that 600 to 700 nanometers of energy.
And in what situation we need to decide what filter we need to use?
Just always use the 590 filter
А вообще обычно используют вот это 590 фильтр.
for dry eye.
Для сухого глаза вообще только вот это используется.
So this is all set for you. And I'm actually going to program this so it's all set for you. So you always want to do multi-pulse because we're getting close to the lid margin. We always want to do 6 milliseconds of on pulse. The only time that you want to change the thermal relaxation time is darker and darker skins. So, go ahead.
У нас получается, что время стандартное, что вот этот тройной импульс мы ставим всегда, время одного импульса 6 миллисекунд, мы как тоже всегда ставим. И что мы можем регулировать, только время между импульсами, потому что когда темная кожа, то да, больше мы делаем время паузы.
So say for example, somebody comes in even darker than me, you tried 10 joules of energy and they're still saying it's painful, then the one thing that you can do is you can actually increase the thermal relaxation time.
Если происходит темный, скажем, темнее, чем у него кожа, то мы начинаем 10 джоулей, у нас стало 50, а он чувствует, что больно, да, пациент, и мы прибавляем это время, скажем, 100 получается, время между импульсами.
So what that allows the skin to absorb that energy and have a little break before you give it another pulse of energy.
Ну, надо, чтобы кожа немножко отдохнула, там охладилась, для того, чтобы дадим следующий импульс.
But for 95% of the patients
Но для большинства
that you're going to be treating, you're going to use these parameters. And then I'm going to set it at 13.
Для большинства вот этих параметров, которые 50 миллисекунд, достаточно для охлаждения.
And then we're going to go here. Set to Toyos IPL. Check. Okay. So whenever you want to start the machine, get it on IPL and then just go here. It'll be Toyos IPL. You just click there and then you're all set.
Если вы когда захотите, ну, как пользоваться ходом машины, то вот здесь вот параметры, ну, как вот Toyos IPL, и, соответственно, идем в базу данных, нажимаем на эту строку, и вот эти данные, они нам автоматически уже появятся. Все данные мы можем сохранить.
Okay, so we'll see how much you learn. So how many joules for me?
Как вы поняли, сколько?
10. Okay. And then how about for her? What would you do?
15.
Okay, you can so you can give her 13, 14 because she's young. She's young. Now if she were 60 and had severe meibomian gland dysfunction, then we could give her 15. But most of the time in the skin that I see around here, you're going to be 14 to 13. 14 to 13.
13 или 14, если очень пожилой пациент или сильное заболевание мебомиевых желез, тогда может быть 15.
And I haven't seen anybody darker than me, but if you get somebody that's even has some pigment in their skin, you can go 10, 11, 12, 11.
Но если более пигментированно, то меньше, тогда 10, 12.
Okay. So with her skin, you see she's got some pigment in her skin, little spots of pigment. So she's going to be absorbing more energy in those pigment areas of pigment. So we're going to give her 13. Okay. All right. So we're going to go ahead and use these. These aren't the normal shields that I use. Anybody got a scissor? Some scissors?
Can we get a scissor?
Perfect. Let's make this a little bit smaller.
Здесь есть многоразовые. Здесь есть вот такие. Надеваются постоянно. Почему? Только глаза закрываются. Ну, солярий. Можно китайский, да, на этом самом для солярия. Они продают 50 рублей. Стоит на AliExpress.
Okay, so the goal is, if these are what you're going to be using, I would cut them down and make them a little smaller and have them open eyes and look up. Toto, look up. And then you just want to put it right where the eyelashes are. Now Toto, close. Toto, close her eye.
Закрывайте, как спать.
No, Toto, close. Keep it closed.
Полностью закрывайте, не открывайте.
Okay, good.
Потому что значит, представляется по краю нижнего века. И
So the goal with these shields is to make sure that the patient's eyes are going to be closed. So The reason why I made it thinner is because we want exposure of that lid margin there so that we can actually get some energy to the meibomian glands. So, total close.
Значит, да, теперь закрывайте глаза.
Good.
Да, отрезал, чтобы причем.
Good. Okay. So that
Теперь
actually,
закрытыми глазами.
that actually works pretty good. Then what we want to do is we want to use some ultrasound gel. This will direct the light to where we want, and also it'll allow me to move the glide and move the tip through the skin. So remember, we're going to treat ear, trachea to trachea, and then we're going to do that twice. So we're going to do that once, and then come back here and do it again. So then you're also going to tell the patient they're going to see a bright light, they're going to feel some heat, and it's going to feel like a little rubber band is hitting their skin.
Значит, да, пациенту говорим, что может быть яркие вспышки, может быть некое тепло, и как такой вот как удар. Так, значит,
Расскажите пациенту.
так, смотрите, сейчас, значит, глаза закрыли, почему, может быть, вспышки света будут, как немножко тепло и такие покалывания легкие. Ну, главное, с закрытыми глазами сидите. Хорошо?
Okay. So you get this ready, it says okay. Now we're ready to go. So tell her 1, 2, 3.
Не, ну просто закрывайте глаза. В очках можно. Нет, ну у вас очки, они ощущают.
So the important shots are right here at the lid margin. So you want to get right at the lid margin, and these parameters are completely safe to do on the lid margin. Ask her how she's doing. Ask her how she's doing.
Как вы себя
Как себя
чувствуете?
чувствуете? Приятно?
What'd she say? She's okay?
Да. Есть чувство тепла или что-то?
All right. So you do more gel, and then we go again. The important ones are right there, here at that lid margin. So what I'm doing is, when I'm doing these treatments, I don't wear glasses. I just put the handpiece right on the skin, and then I close my eyes when I cut. All right. So I've turned it off. So what I want to show you, so when we were treating, no, I'm not going to treat. I'm not treating. So we're treating here, but you want to get this close to lid margin. And as long as she's keeping that lid closed and you're not hitting the eyelashes, you're not going to have any problems. So this is what I was doing. Right there on the eyelash margin, right there. And then what we found, going ear to ear is the best treatment. We tried everything. We tried just the lids, we tried full face, we tried ear to ear and then above the eyebrow. But the best results were 2 passes, ear to ear. Then we need some Kleenex. So right after you do the treatment, you just clean this off. Remember, the xenon flash lamp, this IPL, kills bacteria, so you don't have to worry about any kind of bacterial growth. Then an easy way so that you're not using a ton of Kleenex is just you take what you use for the eye shields. And this will save you on using a ton of Kleenex. So what'd she think? Was it bad? How's she doing?
Как себя чувствуете?
What did she say?
Everything is okay.
Everything's okay? Did she think it was painful?
Чуть болезненные были какие-нибудь ощущения? Какие-нибудь болезненные ощущения там что-то?
Нет, ничего, как будто поспала еще.
She didn't feel herself as she's not sleeping.
Oh, she's sleeping. Oh, okay. Well, good. Yeah, Russians are tough, so it'll be okay. But it shouldn't be painful. So if it's painful, then you can lower the energy. So say I was hitting her and she was like doing this every time, then lower the energy.
Ну, то есть, да, если чувствуешь, что больно, то надо уменьшить энергию, что бывает так.
And you don't have to lower the energy by a lot, just one joule. So you go from 13 to 12 and see if they can tolerate it. But it shouldn't be painful. It doesn't have to be painful to be working.
Но не нужно, что болезненно, что работает.
Okay. So now we would take her and we would do expression. Are we going to do expression? Yeah, that's fine. But we need a slit lamp. We got to do this.
Нужна шилевая
Oh,
лампа
okay.
и
Okay. We'll get her over here. And then we need some proparacaine or lidocaine or do you have any numbing drops?
What jobs do you need?
Numbing? Do you have any proparacaine or tetracaine or?
Ультракаин, ну или этот, возьми инокаин, короче. Сейчас. Обезволивающий.
And then afterwards, we're going to need some anti-inflammatory. Do you have an anti-inflammatory?
Yes, I have.
And then, how about brominidine? Do you have any brominidine?
Yeah, we have.
Okay, you can bring that too.
and we ask how we need to disinfect this.
You don't have to. Just
I need to
it's
put
self-disinfecting. So,
you know,
so the light is disinfecting it for you. So you just have to.
Убирает как бы по цвету.
The main thing is right after you do the IPL.
Сам очищаешь, скажем так.
Только вытереть. Только обязательно, да, нужно, как что-то сделали, сразу было пройти.
That tetracaine?
Yes,
Да, на инструкции написано. Нет, надо сразу вычистить, значит, потом царапать.
Держи, я возьму за этот проксинак возьму.
Ну, телефон это не увидишь, к сожалению. Микроскоп нужен.
нужно снять.
Все, мы завтра нужны.
So tell her what I'm going to do now is I'm going to express her glands. So I gave her a numbing drop, so she should not feel this. But tell her to look up.
Наверх.
Не видно будет. Телефон.
Yeah, so she's making a whole bunch of toothpaste-like secretions. So she's got bad dry eye. You tell her to bring her forehead here
Лоб вперед до упора.
and then look up again. You want to look? See the? You want to go ahead and look? No, you're look. You're not, it's not gonna. It's not gonna be on video. It's too bright. It's gonna be too bright. But if you want to look through you see the stuff that's coming out. So it's like the video. Do you guys see the stuff that's coming out?
After one procedure.
Yeah. Do you guys want to see? You want to see the stuff that's coming out of her glands? You see that? So she's got toothpaste coming out of her glands. Tell her to blink. Tell her to blink.
Поморгайте. Наклоните голову вперед.
Good. And look up. Tell her to look up.
Наверх, смотри.
No,
Смотрите,
look up.
наверх, наверх.
So she's got a lot of junk in her glands. So when you do, tell them when you do expression, the gland is like a test tube. So all that stuff is accumulating in the bottom of the test tube. So what you want to do is you want to squeeze from the bottom and get all that stuff out. You don't want to squeeze in the middle. If you squeeze in the middle, you'll pinch off the lower part of the meibomian gland, and you won't get all the stuff out. All right, now tell her to look down. So that energy, when we were treating her here and her eyes closed, that energy is going up to the upper lid.
Потому что когда мы лечим глаза вместе, да, и, соответственно, на верхний век тоже энергия попадает.
She's a lot of toothpaste. She's got bad dry eye. We're getting a lot of junk out of these glands. Tell her to look down. Look down.
Посмотрите вниз.
And then look up. You guys want to see? She's got a lot of toothpaste. And looked out. Good. That's it. And then now I give her the anti-inflammatory. Okay. And then a drop of brominidine, and then she uses the anti-inflammatory twice a day for the next 3 days. And then she comes back in 2 weeks, and you do it again. And then she's going to need 4 treatments. Because everything that was, all her glands were making toothpaste. So she's severe dry eye disease. Does she know she has dry eye? Right? She knows. It wasn't bad, right? Okay. Спасибо.
Спасибо вам большое.
Good.